Hi, and welcome to this week's video. In this video, we will be discussing the top healthcare industry disruptions, and we'll share recommendations to help stabilize these disruptions. Now let's join Kelly for this week's topic.
Hello, I'm Kelly with Whittle Advisors. Happy New Year! As a strategist, I'm always excited for the beginning of a brand new calendar year. It's the one time of year that the world joins my thought process and begins to plan and strategize, develop goals and objectives. It is heaven for a strategist like me. Today, I'm going to share with you Whittle Advisors' thoughts about 2017. We believe that 2017 will be the year of healthcare disruption. I've brought along 2 disruptions and some recommendations on how your organization can prepare for and manage these disruptions. The first, the new Trump administration will deal with the ACA. They campaigned on this promise and they're already preparing for what that might look like. This is sure to cause lots of chaos and noise in the industry. And at Whittle Advisors, we recommend that you keep your organization and teams focused by continuing your transition to value-based healthcare. Value-based healthcare, as you might recall, is based on 3 objectives. The first, improve patient quality outcomes. The second, reduce cost. And the third, to help increase the health of our populations. All 3 of these objectives will remain valid regardless of what the Trump administration decides to do with the ACA. Stay focused and continue your transition. Now you might think, is my organization on track to be successful under value-based healthcare? And I can help you with that. The first is, are you meeting your current quality target metrics? Or are you getting a penalty? The second question, do the individual contributors in my organization understand the requirements of value-based healthcare? Do they know that we have a plan and a strategy to make the transition? And can they speak to this? Number 3, can we access and share clinical documentation in the right place at the right time for the right patient? If you answered no to 2 or more of these questions, it's an indication that your organization is losing ground in the transition to value-based healthcare. You'll need to do some remediation to catch up and avoid those penalties and to be successful in 2017 and beyond. Let's think about disruption number 2. It is emerging technologies. In the healthcare industry, we haven't had to deal with many disruptions due to emerging technologies. And what I mean by that is mobile devices, apps, and smart devices that are aggregating and collecting data on our patient or customer base that we'll need to be able to interact with. We're already behind in the healthcare industry over other markets like the consumer market or the telecommunications market. Disruptions in the healthcare market are likely to impact our $5 trillion industry. And you can begin to be prepared by developing policies and procedures. I recommend that you start with developing specific policies that deal with patient-created and distributed data. Think about Fitbit data and other biometric data that's collected by smart devices. In 2017, patients are going to want to start contributing that data to their medical record to keep their providers informed. You'll need a policy and a procedure to be able to manage this. Think about this new data and the challenges it will create for our organizations. You might need to hire new skill sets and new technicians to be able to manage this type of disruption. 2017 is sure to be the year of healthcare disruptions. We're at a tipping point in the transitions of our business models, technology, and innovations. I invite you to reach out to Whittle Advisors for transition assistance. Like, share, and comment at the links below. I'll see you next time.